Welcome back to Adelante, Chicago. Many Latinas diagnosed with breast cancer can often encounter a lack of resources to not only inform themselves about the disease and treatment, but also without much support outside of the immediate family, especially if they only speak Spanish. Well, an upcoming forum at the Robert H. Lurie Medical Research Center will hope to answer all the questions and introduce all possible resources en español. Joining me now to talk about Foro Comunitario sobre Cáncer de Seno is Patty Cagney-Sheehan, board member of ALAS and owner of Second Act Boutique, a cancer recovery boutique accredited by the American Board of Certification in Orthotics. Patty, good morning.
Nice to meet you.
I apologize, my voice, I have a bit of a cold. Well, so bear with me.
Sure.
Tell me a little bit about this forum in Spanish. No, you don't have to tell me in Spanish.
There.
You tell me in English that the forum will be in Spanish.
Unfortunately, I'm the only person in the group that doesn't speak Spanish. It is going to be a question and answer forum. The Robert Lurie Center has done this in English every year for quite a few years, but this is the first time we're doing it in Spanish. So it will have 4 members of the panel, and it will be set up where women can come up to the microphone and ask questions. So the doctors involved will be Dr. Santamaria, who is hematology oncology at Northwestern, Dr. Claudia Tellez, who is also an oncologist at Northwestern. It will be Dr. Solari, who is a radiologist, and then it will be also Dr. Alvarado, who is a breast surgeon from Illinois Masonic.
So they're going to cover the gamut from diagnosis to procedures to recovery.
Yes, it'll be. We try to ask people to keep the questions general because we can't address any individual situations. Right. But yes, they are welcome to ask any questions they want about what they or a family member or somebody else might be facing or going through.
What did you notice that prompted a Spanish forum?
The fact that English is not the first language for most of the ladies that we work with, they are hesitant to stand up in front of a group and ask questions. They may have attended the English language forums in the past, but they've stayed in the background. So this is a chance for them to come forward and ask their questions from people who understand them and can answer their needs.
When you say ladies that we work with, you work with ALAS.
Yes.
Tell us about ALAS and what they do.
ALAS was started by Judy Giedelman. Judy is a breast cancer survivor herself and native Argentinian. And so she wanted to put together a program that would help the Latinas of Chicago. So we do Spanish language support groups at various locations throughout the city. And we also do what we call mobile salons, where we go out to the community and we provide free breast forms and bras for ladies who are uninsured or underinsured who would otherwise not have access to these products.
And this is where your boutique comes in, right? Tell me about Second Act.
Well, I'm actually a certified mastectomy fitter.
Which means?
Which means I am trained specifically to fit women in bras and breast forms.
You brought props.
I did, because it always helps.
Because I think it's very important. I didn't even know about what that entailed.
So most women think when they hear breast cancer and surgery, they think of Angelina Jolie and reconstruction. But that's really something that most women do not have access to. This is a typical breast form. It is designed to look and feel like a natural breast.
It does, yeah.
And they come in sizes, of course. And then what I do is I fit ladies in bras, sometimes very pretty red ones, and they have pockets. And so the prosthesis goes right into the pocket. And so our issue is we don't want ladies walking around with socks stuffed in their bras.
Right.
And so we tell them about this, and then we, more than that, at ALAS, we're able to provide them at no cost to the women.
For free?
Yes.
Because that is expensive.
It is expensive, but it's normally covered by insurance and Medicare and Medicaid.
But if they don't have insurance...
But we have a lot of ladies who don't have any of that, or they have insurance and they can't afford their deductible.
Right.
So they're essentially uninsured.
What I find interesting, too, is the angle of the support group. Because usually these ladies are talking to the immediate family, but they don't have a friend to talk to in their language about this, or maybe a doctor who can support them and on the emotional side of recovery. And that is so important. Studies have proved that it is very important.
There is that. There's also the fact that we do some other programs. We do yoga, which is very helpful. And there's also the fact that some of these ladies don't even talk to their families.
Right.
Because they are the strong person in their family. They can't let on to how they are suffering. So it's important for them to be able to talk to others who have been through it.
Will you be at the forum also with the prosthesis and that kind of information?
I will. They have an area outside of the forum in the hallway around it where they have several vendors or other kinds of providers with information. So we will have a table there for Alas, and I will be at that table. And there will be several other tables there with other information, other nonprofits, all nonprofits, organizations that offer services in the area.
And we wanted to send our best to Judy. We know she's recovering.
Judy is recovering herself from bilateral mastectomy surgery right now. That's why she's not here.
We're going to send her our best. In the forum, Foro Comunitario sobre Cáncer de Seno, it's Sunday, October 18th, from 10 a.m. to 12 p.m. at 303 East Superior Street. For more information, cancer.northwestern.edu/foro_seno. It's a lot, but it's so worth it.
Thank you. Or alaswings.org.
Perfect. alaswings.org, and that way you can find out more information about Alas. Thank you so much, Patty.